Yes, okay, as Bisa has just said, my name is Dan Clark, and I've spent something like 35 years in the field of engineering in healthcare. And during that time, I've worked in many clinical areas. I've supported clinical colleagues in operating theatres, in intensive care departments. I've worked in imaging and diagnostics, in emergency medicine, care of the elderly, and many others, too many to mention. I'm currently the head of service for a clinical engineering department in a big hospital right in the middle of the UK, where we currently look after something like 70,000 items of medical equipment. And my role there is in supporting the clinical teams to make sure that they can use that technology and get the best use of that technology to care for our patients. But I'm also a professor of engineering at a large UK university, where I support the development of new technology, new ideas of how to use engineering to solve healthcare problems. And I've been involved in the development of new imaging devices, of sensors to detect diseases, technology to prevent injury, improve operations, and enable people to live more independent lives. And whether I'm supporting the existing technology used in healthcare or helping to develop new technology, throughout my career, it's been about applying the discipline of engineering to improve health. And really, what could be more rewarding than that? So this morning, it's an absolute pleasure to be here to talk about engineering in healthcare. It's such a huge subject. We can barely scratch the surface in the 30 minutes or so we've got today. But hopefully it'll give you a taste, a flavour of the fantastic world of engineering in healthcare. So when we think about engineering then, I guess we all can recognise the contribution that engineering has made throughout the world. The computer that you're probably watching this Zoom call on today owes much of its design and its capabilities to engineering. The building you're in, a result of civil engineering. The roads, the bridges, the transport systems we rely on, from cars to buses to planes, they're all the product of engineering. So when we think about engineering, we might picture skyscrapers and train stations. We might picture planes and rockets. We might think of major construction projects. We might even think about robotics and spaceflight. All are the result of engineering. And of course, these are all fantastic things to do with science and engineering. And I would celebrate anybody that works in these areas. But a branch of engineering that I think is even more exciting than all of this, a branch of science and technology concerned with all these things is actually even more exciting, even more rewarding, perhaps less well known, less appreciated, less often seen. But it's the one in which I believe should be lauded above all the others. I would say that, wouldn't I? Lauded above all the others. It has as many challenges to solve, as many hurdles to overcome, but which directs all of its efforts to trying to make poorly people, sick people, better, and improving the quality of people's lives, keeping people healthy and living independent lives for longer. And it's that branch of engineering applied to healthcare, and the careers that we can have in that branch of engineering, which I'd like to introduce to you today. So it's a big topic. I'm gonna try, a very diverse topic. So I'm gonna try and break it up a little bit by talking about 4 broad themes, and those are healthcare technology management. That's looking after the existing technology, the current technology that's being used in healthcare today. Then there's healthcare technology application. So that's actually using the technology in the clinical environment and in clinical settings. And then there's healthcare technology innovation, developing, designing, deploying new technology for use in health and well-being. And then finally, a slightly less obvious one, and that's healthcare technology assessment, assessing and evaluating technology to decide which technology should be used in healthcare, and helping our decision makers, our managers, our politicians to decide how to introduce technology into healthcare. So let's look at each of those in turn now. So I'm going to start with what is perhaps the biggest of those in terms of the number of people that it employs, and that's healthcare technology healthcare technology management. Sorry, I'm getting quite a bit of feedback, but never mind, I'll press on. So healthcare technology management then, we have a lot of equipment, a lot of technology currently used in healthcare. We've already heard about quite a lot of those items, you know, the MRIs, the linear accelerators used in radiotherapy, the diagnostic machines, CTs and PET scanners. But there's a huge amount of other equipment too, from the beds that patients lie on to walking sticks that they might use, perhaps equipment that's used in operating theatres, robotic surgery these days as well. And the technology gets used in a whole variety of places. Clearly, it gets used in hospitals, intensive care departments, theatres and on the wards, but it also gets used in people's homes and in residential homes for older people. So technology is massively important in the way that we look after patients and people with needs in the modern world. And this technology needs to be looked after. It needs to be managed. It needs to be maintained. And that's what the field of healthcare technology management is all about. Now, if we stop for a minute and think about why equipment, why technology in healthcare is so important. We have technology all over the place. We have televisions at home. We have kettles in our kitchens. We have cars and other vehicles. Why is technology in hospitals so special? And it's so special for two fundamental reasons. Firstly, if you stop and think about what that equipment does, the function of equipment in healthcare, it is often critical to patients' well-being. Indeed, it often keeps people alive. So clearly, we need to look after that technology well if it's keeping somebody alive, if it's making them better. So we need special skills and special careers for people to look after that equipment. And then secondly, we might want to think about who is the beneficiary, who is the end user of that equipment. And the end user of that equipment is very often the most vulnerable, the most fragile people in our society, from very little babies, premature babies, to people who are being kept alive in intensive care departments. So the equipment that we use in healthcare has a critical function for the most vulnerable people. So we need to take extra special care of that equipment. And that's what healthcare technology management is about. In terms of what do we do when we're looking after that equipment, it very much depends on the equipment. And you can imagine there's a huge variety of equipment used in healthcare. But for all of those, we sometimes talk about the life cycle of the equipment, the life cycle management of the technology. So that includes a number of things. Even before we buy it, before we even get the equipment, we need to be thinking about how we're going to use it. Is it going to be safe? Can we actually install it and use it in our healthcare facility, in our hospital, or in our doctor's office? So before we even buy it, we need to be evaluating that technology. And once we've got it, we need to make sure it's safe and can be deployed safely. It's working correctly as the manufacturer expects. And we need technicians and technologists to do that for us. Before we let clinical staff use it, we need to make sure those clinical staff know how to use it. And some equipment is very technical, very complicated. So engineers and technicians are often involved in teaching clinical staff how to use that technology. And then once it is delivered, once it's being used in the hospital or in the clinical environment, it often needs routine servicing. So, you know, every year or every 6 months, there might be things that need to be changed and checked to make sure it continues to work safely and effectively. Sometimes it needs, clinical staff need support, things need changing, consumables need fitting, circuits need changing. So that's in-service support to keep it running smoothly. And then, of course, sometimes equipment fails, equipment breaks down. And in those circumstances, technicians, technologists, engineers need to be there to help repair that equipment and get it back into good condition and working again. And then eventually that equipment will need to be replaced with new equipment when it gets so old we can't keep it going safely anymore. So engineers, technologists need to be involved in that cycle again of how we replace it and start again with that pre-acquisition evaluation. In short, technicians, technologists, engineers working in healthcare need to ensure that the equipment is that we have the right equipment, it's in the right place at the right time and in the right conditions to be used safely on our patients. And that's the discipline of healthcare technology management. So the second broad theme I'd like to just mention briefly today is healthcare technology application. So we know that there is a huge amount of equipment used in modern healthcare. And by and large, that technology is actually used by healthcare professionals, so by doctors and nurses and physiotherapists in many clinical areas, from operating theatres to intensive care to the wards, to all over the healthcare establishments. Technology is used, and usually by a healthcare professional. But sometimes that technology is so complicated, so specialist, that we need specialist engineers and technicians in order to use it safely. And that's the area where scientists and engineers, if we really like technology and using technology, but we also really like being in a clinical space, actually where the patients are, helping the patients, helping the clinical staff, then this is the broad area of healthcare technology application, where there are lots of career opportunities. I'm just going to, honestly, there's loads of these. I could spend days talking to you about them, but I'm just going to touch on 2 or 3 to give you an idea of the sort of place that technicians and people with engineering skills can get involved. So here's just a list, and we generally refer to these areas as the broad topic of physiological measurement, but different countries, different hospitals might call it clinical measurement or other names. But it's using specialist equipment to make recordings of physiological, of things that are going on in the body. So the top one on that list there, EEG, that's measuring brain waves. So the top right-hand picture is an ECG being taken place. You can see that it's a fancy piece of kit, lots of wires, lots of electrodes recording incredibly sensitive electrical signals from somebody's brain, and that can tell you an awful lot about how the brain is functioning, and it's used to diagnose a whole range of problems and difficulties that a patient might have, from epilepsy to tumors and a whole range of other things. One that you're perhaps more familiar with is the ECG. So that measures the heart rate. It's a very complex set of systems. In routine practice, that's often just done by medical staff, but in specialist centres, we sometimes use technicians to make those measurements. Intracranial pressure, so that's the pressure inside the skull. The skull is a closed box, so if your brain starts to swell up because of injury or disease, then the pressure increases, and that can cause, obviously, a lot of difficulties. So measuring that is a very specialist skill, and technicians and engineering people can get involved in doing that. Spinal cord monitoring. If a surgeon is operating on a patient's back, on a patient's spine, it's clearly hugely important that they don't damage that spine. So technicians get involved in ensuring that the spinal cord is still working. We take measurements on people's legs, for example, while the surgeon is working on their neck, just to make sure that they're not doing any damage during that. Vascular measurement taken all over the place, but the picture there in the bottom left-hand picture there is somebody having their carotid artery measured with an ultrasound probe. That's very important for things like stroke management and detecting whether someone might have a stroke, to see how much blood is moving through the major vessels. And that gets used in lots of applications. Visual electrophysiology, measuring the eyes, are they working properly? And then ultrasound, you've probably seen in terms of looking for babies in the womb, but ultrasound gets used in a whole range of other applications, and there are many more. So if you like technology and using equipment, but you actually also like being in a clinical environment, literally with your hands on patients, then physiological measurement is possibly a career that you might want to consider. If we move on to another aspect of this broad area of healthcare, of health technology application, and it's one that I've been involved with in the past, and it's incredibly rewarding. And it's a broad area that we sometimes refer to as rehabilitation engineering. So there are many patients, many people who have special needs. Either they have disabilities or other disadvantages which makes everyday living problematic for them. Typically, that might be something like somebody who needs a specialist wheelchair, not just a normal wheelchair, a wheelchair that can do special things and is designed specifically for one individual. And engineers get involved in designing those specialist wheelchairs. And there are other mobility aids, aids for helping people to stand or to walk, artificial limbs, and ways to model those artificial limbs. All comes under this area of mobility aids. And then there are some people who have difficulty talking, so they haven't got communication skills. And there are things that we can build as engineers to help people communicate who can't talk. Then there are robotics. The picture in the right hand there shows an exoskeleton robotic device to help somebody who's lost the use of their hands, still has their hands, but they can't use them. And so there's an exoskeleton robotic device there. So that's a whole new area that's being looked at. Assistive aids, these are things for around the house. So to help people eat or to help people move and do things in their own homes. Gait analysis is another hugely exciting area that we can get involved with as engineers. We can study how people walk. It seems like a simple thing, but in fact, because of disease or disability, some people have great difficulty in walking, and we can help them with that with gait analysis. So again, it's an application of engineering, but you're very, very close to the patient and often working with an individual patient. So it's engineering, but it's very much in the clinical space. Okay, let's move on to the third broad theme, and that's healthcare technology innovation. And it's an area that I've been heavily involved with over my career. We know, of course, that there's lots of technology already used in healthcare, and we need engineers, technologists to look after that equipment. But what about new equipment? Where does new equipment come from? What about developments to existing equipment? Who's responsible for doing that? Who comes up with the ideas for new technology, and how do they get developed? Well, clinical engineers, healthcare engineers, are the people who do that. We're already in hospitals, we're already in healthcare, we see equipment being used all the time, and we have ideas for how to improve it, working, of course, alongside clinical colleagues to that. So this is the broad area that we might refer to as healthcare technology innovation, getting new technology into hospitals. Now, technology develops. It develops in all fields, not just in healthcare, of course. New TVs are coming on, new cars get developed. But in healthcare, obviously, we get new equipment to support our patients' needs. So here's just a couple of examples that there is on the left-hand side of this slide. At the top left-hand side, we can see one of the first dialysis machines designed to take the blood out of the patient, pass it through a series of filters to clean it from the toxins before putting it back into the patient, to do what your kidney should do for patients who have kidney failure. And over the years, clinical engineers and others have refined this, designed this, developed newer versions which are smaller, quicker, and more efficient at cleaning the blood into what is now modern dialysis machines. And then on the right-hand side of this slide, you can see, perhaps not very well, it's not a great photograph, I'm sorry, but one of the very earliest infant incubators, which is literally a tin box that was kept warm and oxygen passed into it to help a poorly newborn baby. And again, over many years, engineers, clinical engineers have developed better and better types of incubators until we see the modern variety that we use in hospitals today. And these are just two examples, of course. All the time, clinical engineers and scientists working in hospitals are using technology alongside our clinical colleagues, and we can see ways that they can be improved. And we have a really important role in developing technology of the future. I thought I might just mention two very quick projects that I've been involved with in terms of new technology that I've been, as I say, designing in the last few years, just to give you a flavour of some of the stuff that clinical engineers can get up to in terms of new technology and technology innovation. So on the right-hand side of this slide, then we're using a new imaging technology which utilises hyperspectral imaging to understand how foot ulcers in patients with diabetes develop, and more importantly, how we can understand that and how we can treat them so that they don't get worse. Diabetic foot ulcers are a huge problem in global healthcare. If not treated correctly, they often lead to amputations, and the human burden and the cost burden of looking after that is massive. In our new technology, we're using hyperspectral imaging, and a hyperspectral imaging camera is I guess, a little bit like a normal camera, except that each pixel, instead of just having one element, we have an entire spectrum. So at every single point on the picture, we have an entire spectrum. And then we can use clever maths and some clever ideas in science in the background to calculate the amount of oxygen in this case that is being used in each pixel. So the picture shows a diabetic foot ulcer on the left, and then on the right, the amount of oxygen that's being consumed by the tissue in it. And through that, our doctors can understand whether the ulcer is getting better or worse and how to treat it. So we're saving people from getting ulcers that get worse and worse and lead to amputation. And then very quickly on the right-hand side of this chart, we can see a new neonatal transport system that we've developed recently. We often have to move very tiny, very poorly babies, usually from smaller hospitals, to bring them into the major centres where we can treat them. But to transport them, we need to put them in an incubator, and we need that incubator to be put in an ambulance. So that ambulance then rattles around on the busy roads, and the baby gets shaken and exposed to vibration. Should that ambulance stop suddenly or be involved in a crash, then the baby might fly around inside the incubator. So we've been using mathematical modeling with our computer scientists. We've been looking at damping techniques with our mechanical engineering staff, and we've been working with Land Rover, Jaguar Land Rover, a car manufacturer in the UK, to design a new system which is safer for transporting our babies, and also exposes them to less vibration and less noise. So these are just two examples. Clearly there are one of the really fun things, one of the exciting things about working in this field is that there is no shortage of challenges facing us that engineers and technicians can be involved in solving those challenges, and that's the exciting thing about the world that we work in. So I'm just going to mention one final discipline that engineers get involved with in healthcare. It's less well known, I guess, and it's the discipline of healthcare technology assessment. And this is where we can use our skills and the discipline of engineering to assess and evaluate technology, and help doctors and help managers and help politicians decide what technology is best for our healthcare to look after our patients, and also which technology can we afford, because technology can be expensive. So health technology assessment as a discipline brings all of that together to make decisions. So what is HTA? Well, demands of healthcare are increasing all the time. As populations tend to be getting older, we tend to be getting more prone for long-term conditions like diabetes, but also like coronary heart disease and dementia. Life expectancies are increasing globally, and the demands that we place on healthcare therefore are increasing as well. And this is a challenge for all of us, because the healthcare system in general needs to do more and more, and in general, budgets, finances, money to do that is certainly not getting more, and in many cases is getting less. So the question that we have is, how do we provide more healthcare with limited resources? And that's where we as engineers can become involved to answer some of these really difficult questions. If you've got a finite amount of money, a finite resource, do you spend it on conditions like diabetes or chronic heart disease, mental health, or should you spend it on acute care like cancer, for example? Should you spend our money, our resources on babies who, after all, are at the very beginning of their life with a lot ahead of them, or on our vulnerable older people? And once you know when to intervene, what should you intervene with? What technology should you bring in? We may know that a drug is good but expensive, and then a manufacturer produces another drug which is cheaper, but is it as good? How do you assess those things? And engineers can often get involved in that when it comes to devices and technology. How can we create new and deploy new technology that will be even better for our patients, but also sustainable, affordable for our healthcare systems? So there's a lot that engineers can do in this. We have skills at assessment, we have skills at modeling, we can look at processes, because that's what engineers do, and methodologies, and we can really help these decision-making problems that our politicians and our hospital managers have to do. So wherever you are in the world, be that in Nigeria, be that in the UK or be that anywhere else for that matter, we know that there are huge challenges facing healthcare. Not always, of course, but very often those challenges will have technological solutions. And so engineers and technicians working in healthcare have an opportunity and indeed a responsibility to try and support those solutions. So choosing a career in healthcare engineering then is both very challenging, but also hugely rewarding. In terms of careers then, just briefly now, as I realize we're a bit behind on time, but in terms of careers, it's important to look at where, what employment sector you might choose or be able to work in. And there's essentially three broad employers, three broad employment sectors. The most obvious, I guess, is the actual healthcare delivery itself, whether that's in a hospital, or in a clinic, in a home setting, working for people who provide healthcare. And that's essentially where I've been for most of my career, working in a hospital and in healthcare settings, alongside doctors and nurses and physiotherapists and others, and supporting their technological needs. But there's also academia. There's a lot of work goes on, particularly obviously in healthcare technology innovation that's done in universities and in larger hospitals, researching new technologies to be used. So there's careers to be had in healthcare technology in academia. And then of course, there's also industry. And industry are hugely important in this. We can have all the brilliant ideas for new technology that we like. We can develop some fantastic new ways of treating patients. But if we don't have industry to make, to manufacture, to distribute that equipment for us, then we might as well not bother. So industry are a hugely important partners. They make a lot of they make all of the major technology that goes into hospitals and healthcare settings, and they need engineers and technicians working with them to develop new technologies. And there are some very large companies that dominate in this sector, but there's also a lot of very small companies that are coming up with new ideas. So there's often employment opportunity in the industry sector looking at healthcare technology. In terms of roles that you can do as an engineer or as an engineering practitioner in healthcare, there are loads, and I could spend a long time talking about each of these, but it's really just to give you a flavour of the types of things that people can do. So you might start at the beginning, I suppose, with our apprentices. So people essentially straight out of school with some science and engineering aptitude, with some higher school level qualifications, and they can come in and there are, I'm not sure about the position in Nigeria, you'll have to forgive me, but in the UK and in Europe, there are often apprenticeship roles where people can come in and support full-time staff in hospitals whilst they develop their own skills, and often whilst they develop qualifications. And then there are technical roles, so technicians and technologists. So if you've got one of the questions earlier today was about somebody with an HNC or an HND in electronics. Well, technicians generally have that level of qualification, and then they work in a hospital or an academic or an industrial background, and they get further training, specific training on the medical equipment, but with a good electronics or mechanical engineering HNC type qualification. And they can do all of that health technology management aspects in a hospital. That's generally where our workforce is at. In that physiological measurement sector, again, these are people with sort of HNC type level, possibly with graduates working in the clinical environment. And then there are advanced practitioners. Advanced practitioners are people with science and engineering backgrounds who've worked in hospitals, worked in physiological measurement, and start taking on the role of doctors. They start actually not only using the equipment and supporting other people in using the equipment, but they often actually interpret the results and make diagnosis in partnership, it has to be said, in partnership with doctors. But advanced practitioners are really at that sort of almost at a medical doctor level. Within the engineering the specialties themselves, obviously there are engineers who have a first degree in engineering, often then go on to get an MSc in engineering, and then dedicate that to healthcare technology. In the UK, there are specialist training programs for those engineers. Again, forgive me, I don't know specifically what those training programs would look like in Nigeria. In the academic world, there is doctoral and then postdoctoral research posts, moving on to research fellow posts. But these tend to be very much academic department specific and based on funding that particular hospital has, that particular university has. So it would be a case of looking around once you've got your first degree or your MSc, at what excites you, what area of healthcare engineering excites you, if it's imaging, or if it's sensors, or if it's robotics, and finding a university that specializes in those areas. And of course, if you're in the academic world, then you might well progress to become a lecturer or a professor. And ultimately, you might, whichever route you come through, ultimately you might end up being a consultant in clinical engineering with responsibility for many staff, many items of technology in healthcare settings. So those are the sort of wide range of job roles that you can look to in healthcare engineering. Okay, so just in summary then, we've talked a lot about the role that engineering plays in healthcare, and it is a huge role and always developing, always changing, and always an exciting place to be involved. There are four main themes. I mean, they overlap, of course, and you might well find in your career that you work in more than one of them. I've certainly worked in all of them over my career. Some people stay in one, but people can migrate between them. And those four themes are healthcare technology management. So that's looking after the existing technology that we use in healthcare. Healthcare technology application. So that's working in the patient environment, supporting patient diagnoses and support with technology. Then there's healthcare technology innovation. So that's bringing on new ideas, new technology to be used in healthcare. So that's research, often in an academic institution, but also often in larger teaching hospitals. And then that's healthcare technology assessment, how we make decisions about what technology to use and how to set up technology used in healthcare. And all over the world, engineers are needed to develop new technology, to implement technology, to manage it when it's in the hospitals, and to bring forward the next generation of technology into healthcare. I'm biased. I've spent my life working in healthcare technology, of course. But honestly, if you enjoy the discipline of engineering, if you're a scientist that likes building things, if you like to understand how technology and machines work, but you want to work in a patient environment, you want to help people, you want to be alongside colleagues who are helping to look after people who are poorly and make them better and help people live full lives and independent lives, and then what better application of your engineering skills than to work in healthcare technology. So I'm sorry if that's been a bit of a blast. As I said, I could talk about this subject for a long time, but I hope it's been enough to give you an idea of the sorts of things that we do in engineering in healthcare. So thank you very much.